As time goes by, there are more and more medical advances every day. Doctors are able to detect almost anything now, and there is no symptom that is too small for a doctor to research for his or her patients. These advancements allow doctors to tell us more about illnesses and diseases that are more rare and that we have not yet heard of. One important disease to be aware of is Arnold Chari Malformation. I realize that sometimes the idea of knowing there are so many different medical complications can be intimidating, but it is important to know about these in order to take the proper steps. Being the aunt of a niece and nephew who are diagnosed with Arnold Chari Malformation, I have seen firsthand the process of living and dealing with this disease. Today, I would like to share some of this information with you by first explaining what Arnold Chari Malformation is. Then we'll look at some possible symptoms and the testings that must be done in order to make the proper diagnosis. Next, I will explain the professional medical care that must be done. And finally, we'll hear about what it takes to live with this disease in daily life occurrences. To begin, we must first understand what Arnold Chari Malformation is and how it affects the human body. Allison Green, who is a registered nurse, as well as a nursing and health science instructor at Newman College, tells us that Dr. Hans Chari found a number of cerebral anatomic abnormalities dating all the way back to 1891. Registered nurse Allison Green also states a Chari malformation typically refers to a herniation of part of the brain. The Health Center from the University of California, Los Angeles says the malformation is a condition when the bottom part of the cerebellum dips down into the upper spinal canal. The spinal fluid has nowhere to travel, which causes the patient a lot of pressure. With the general information of what Arnold Chari Malformation is, we see how specific this disease is. With that in mind, it is important to know about the symptoms and how to find the malformation. The symptoms are very common, so it is important to keep an eye out for recurring signs. Both Dr. Cormac Maher and Dr. Joseph H. Piatt Jr. have said that some of the symptoms of Chari Malformation are headaches, neck and shoulder aches, visual disturbances, and sleep apnea. According to the National Institute of Health, some other symptoms are to include dizziness, difficulty swallowing, ringing and buzzing in ears, hearing loss, vomiting, and insomnia. The National Organization of Rare Disorders states a diagnosis of a Chari malformation is based upon identification of characteristic symptoms, a detailed patient history, a thorough clinical evaluation, and a neurological examination that includes a variety of specialized tests, including specialized imaging techniques. The same organization explains that an MRI and a plain X-ray are the best way to detect a malformation. After having the proper diagnosis, it is crucial to have a follow-up appointment with your primary doctor in order to find a neurologist who will then continue treatments from that point forward. Since there are 4 different stages of Chari malformation, the treatments tend to differ depending. In some situations, an individual may have Chari malformation but never show any signs. Therefore, it is important just to be monitored, but there may be no treatments necessary. According to webmaryland.com, the doctor will first do a physical examination by checking the patient's functions such as balance, motor skills, sensation, touch, and reflexes, which are all controlled by the cerebellum and spinal cord. As I mentioned, a plain X-ray, MRI, and CAT scan are all options that the doctors have to choose from while figuring out the extent of the diagnosis. That being said, the MRI is still the most commonly used in finding the Chari malformations. Just like in most cases, there are medicines that can be prescribed in order to help cope with uncomfortable pain and aches. However, if the doctor detects functional defects after the physical examination, then surgery is the only option to prevent damage that is being done to the nervous system. During these surgeries, the 2 main intentions are to eliminate pressure and reestablish fluid circulation through the spine. These testings and treatments can feel endless to the patients. There is a lot to consider for those who have Chari Malformation. These people with Chari Malformation normally have a lot of frustration and anticipation built up, normally from being misdiagnosed and feeling discouraged. A professional singer, Roseanne Cash, was diagnosed with Chari Malformation after 10 years of testings and doctor's visits. She had had severe headaches for as long as she could remember, and after being diagnosed with numerous things such as migraines and Lyme disease even, once she was finally diagnosed, she said, "Even though I figured I would have to undergo brain surgery, I was flooded with relief that someone finally knew what was wrong with me." Dr. Ben Carson is one of the world's best neurologists. The following is a quote he made in his book, The Gifted Hands. "I became acutely aware of an unusual ability, a divine gift. I believe of extraordinary eye and hand coordination. It's my belief that God gives us all gifts, special abilities, and that we have the privilege of developing to help us serve Him and humanity. And the gift of eye and hand coordination has been an invaluable asset in surgery. This gift goes beyond eye-hand coordination, encompassing the ability to understand physical relationships, to think in 3 dimensions. Good surgeons must understand the consequences of each action, for they are often not able to see what's happening to the other side of the area which they're actually working. My niece has had the privilege of meeting Dr. Ben Carson, as he has operated on her twice for her Chari Malformation. My nephew, however, fortunately, is very mild, and for right now the doctors are just monitoring. There are so many different aspects that go into Arnold Chari Malformation, and although going to the doctors for something like a headache may seem silly, it's important to pay attention to the reoccurring signs and symptoms. Considering treatment along with the constant ache and sensitivity of a Chari patient is very important in understanding why they might not be able or up to doing daily things. Although Arnold Chari Malformation is still unheard of to some people, it is a much more common diagnosis due to medical advancements that science and researchers have made.